Good morning, I'm Mary Beth Marsden, and this is Know Your Health from LifeBridge Health, where each week we bring you important health information. This week we're talking with Dr. Scott Brown, Chief of the Department of Physical Medicine and Rehabilitation at LifeBridge Health. And we're here to talk about the topic of spasticity. Say that 3 times, right? Dr. Brown, I'm sure you can, and you're going to elaborate a little more about what spasticity is.
Thank you very much. It's nice to be here. Spasticity is the technical medical term for the muscle stiffness that develops after someone has had an injury or an illness that affects the central nervous system. So if you've had an injury or illness to the brain or the spinal cord, which are the 2 parts of your nervous system that we call the central nervous system, because of the neurologic injury, your muscles can become very stiff. So if you think about people who you might have known that have had a stroke or a brain injury or a spinal cord injury, and you might notice that their arm begins to pull up and in towards their side, or the feet might get stuck in the down position, or the legs may be very stiff and difficult to move at the knee. Those are all signs of this problem we call spasticity.
So this is not just stiffness from aging. This goes far more than that.
It's far more than that. It's related to the neurologic injury.
How common is this?
Well, it's very common after insults to the central nervous system. It can occur to varying degrees. So someone can have a stroke or a brain injury and have relatively mild degree of stiffness or spasticity, but other people can develop very, very severe spasticity.
So then I would imagine it could be pretty debilitating.
It can be very debilitating. And it's the sort of problem that can creep up, too. It may not be obvious initially, and it can develop and worsen progressively over time. And by the time someone really recognizes it, someone can develop a contracture where at that point the joints are stuck in a particular position, and then it's almost impossible to move them.
So is it fair to say that someone who's had one of the injuries that you mentioned needs to really be on the lookout, or people around them need to be on the lookout for this?
Absolutely.
What are some of the treatment options once you diagnose this?
Well, there are many treatment options. The most conservative approach is utilizing physical therapy treatments initially, certain types of exercises, certain specialized techniques that the therapists utilize to decrease that tone. That's the term that we use for this increased muscle activity. It's not the same tone as you think of in terms of going to the gym and toning up your muscles. This is neurologic tone. And so the therapists have some specialized techniques to reduce that. We can use various types of splints and braces to reduce that and keep the limbs from contracting.
So I see where the therapists come in, but where do you as the doctor come into play?
So the therapy techniques are the most conservative approach. Then there are medications we can use, and then there are more aggressive treatments using injection therapies, such as Botox. Yes, the same Botox that is used for
Really?
Cosmetic uses and wrinkles we use for this medical purpose, and other medications that we can inject. And then we can also implant a pump directly into the spinal fluid that injects medication to reduce this type of stiffness and spasticity.
I was wondering if you're seeing sort of this type of, I want to call it an injury, but I don't know that it necessarily is, but the muscle stiffness or spasticity. Are you seeing it more and more?
Well, it's such a very common problem after neurologic injuries that I think it goes unrecognized, and the more we educate people about it, the more we tend to see it.
How does your program at Sinai sort of work with the patient and the family?
We have a multidisciplinary spasticity program that really offers the full range of interventions, everything from physical therapy through the injection therapies, including implantation of pumps. So we have a multidisciplinary team with physical therapy, physical medicine doctors like myself, neurosurgeons, interventional radiologists.
Is it possible for patients to get back to 100% of where they were before the injury? Is that your goal, or just looking for moderate improvement?
Well, the goals are always individualized. It depends very much on the individual clinical situation for an individual patient. So some people can have spasticity and still have underlying movement and strength. In that case, treating the spasticity can unlock and reveal the underlying strength and make it more available for functional activities.
Dr. Brown, thank you so much for joining us.
Thank you very much.
We appreciate it. If you'd like to make an appointment with Dr. Brown or to find a LifeBridge Health Rehabilitation Specialist, you can call 410-601-WELL. That's 410-601-WELL, or visit lifebridgehealth.org/rehab. I'm Mary Beth Marsden. Thanks for joining us. It's 10 o'clock.